In order to do a successful joint replacement for the knee, you have to remove the damaged bone and cartilage and create a surface that fits for the implant. And every cut here has to be done perfectly well. And it has to follow the XYZ plane as it should be. So any inclination in this direction, or this way, or rotation-wise, any error can cause a problem and make the joints to fail. The same applies to the leg bone. Although it is one cut on the surface here, but the same, it has to be done well so that there will be no inclination in the XYZ plane. In order to do this operation, during surgery we have to use conventional instrument system, which has been there for about 30 years. And this instrumentation system has at least more than 100 different pieces to help us make the cuts and also position the implant. And one of the steps that we have to do is we have to put a rod inside the medullary canal in order to calculate the axis of the thigh bone and the leg bone. And this has got problems, medical problems. The invention is to replace the more than 100 different pieces of instruments with only 2 pieces of instruments in order to do the operation. One of them used for thigh bone, and because this is done pre-operatively before the surgery on the computer, based on the images on the CT scan of the patient, so it is patient specific. So it can only be used for one patient, and it sits on the bone, so it has built-in information about the position of the cuts on the bone. So it sits in the bone in a unique way, so that it can allow the surgeon to fix it with pins and then to make all the cuts on the bone through these slits. So as we mentioned before, there are 5 cuts on the femur, and here are these 5 cuts are done. That once you make the cuts, you remove that and you remove the bone, and then you insert the implant. And the same for the leg bone, where also you can position a piece here of material which is biocompatible, and once it is positioned and fixed by pins, then the surgeon can use the saw to make the cuts and then remove the bone and insert the implant. And this guarantees that you have accurate placement of the component on the femur and on the tibia, and saves the time of using more than 100 pieces of instrumentation system, and avoid the perforation of the medullary canal that has got many medical complications.